All right, so I was told by Dr. Simmons to give you some information regarding smoking, alcohol, and drug abuse.
Yes.
All right, so let's first go over smoking. With smoking, this includes cigarettes and vaping. Smoking is bad for your health. Over 60 million Americans have at least one disease caused by smoking. Smoking can cause strokes, lung cancer, chronic cough, wheezing, shortness of breath, chronic bronchitis, and coronary heart disease in adults.
Wow. I didn't realize smoking could cause so many different health conditions. I've heard about secondhand smoking and how that can be equally as dangerous. Could you tell me more about that?
Of course, it can cause many other conditions, including SIDS, which is also known as sudden infant death syndrome, risk of developing asthma or worsening existing asthma, makes the frequency of getting sick increase, and also slows the normal growth of children's lungs. To prevent secondhand smoke exposure, you can make sure to avoid being around someone that smokes, especially if they're smoking in their house or car.
I've never smoked before, but someone around me does. Are there any resources that can help me help them stop smoking?
Of course, there is a hotline available that is available for anybody to use. That phone number is 1-800-784-8669 or 1-800-QUIT-NOW. Are there any other questions you have regarding smoking before we go on to the next topic?
No, not that I can think of.
Okay, great. If you do have any other questions, you can research on any trusted source on the internet or ask Dr. Simmons, your primary care, as well. Now let's talk about alcohol use. The impact of alcohol on your health depends on many things, including your age, current health status, and how much you're drinking. 3 in 10 adults drink at levels that put them at risk for alcoholism, liver disease, and other problems. Some signs and symptoms of alcohol abuse include alcoholic odor on breath or skin, irritability, aggression or avoidance, declining personal hygiene, glazed eyes, impaired coordination and or motor skills, and flushed skin. Next, I'm going to go over risk levels for developing these diseases. For low risk, this means you have no more than 4 drinks per day and no more than 14 drinks per week. You are at increased risk if you are drinking more than 4 drinks in a day or more than 14 drinks per week. Also remember that low risk does not mean no risk. You can still have problems if you drink too fast, have a health problem, or are older than 65 years old.
I definitely don't drink more than 4 drinks per day. I probably just drink 2 or 3 drinks every month. Do you think that I'm okay?
According to all the statistics, I would say that's okay, but you can always talk to Dr. Simmons if you have any concerns. Remember that even a little can be too much. If you're planning to drive, taking medications that interact with alcohol, or a doctor has told you that you have liver disease, do not drink at all. If you are worried about the level that you are drinking and think you have a problem, you can talk to a doctor about your drinking, or you can visit rethinkingdrinking.niaa.nih.gov for more resources.
Again, not saying that I have any issues with drinking, but what's really the harm in drinking?
Well, with drinking, it can cause an increase in accidents, injuries, and aggression. For example, alcohol is a factor in 60% of fatal burn injuries, drownings, and murders, 50% of severe trauma injuries, sexual assaults, and 40% of fatal crashes and falls. Drinking alcohol can also cause physical health, emotional, and cognitive problems, problems with relationships, work, and studies. If a woman that is pregnant drinks alcohol, this can also lead to birth defects to the baby.
Whoa, those statistics are crazy. I'm really not worried about alcohol abuse with me or anybody that I know, but I am glad I asked that question before because those statistics are shocking.
They for sure are shocking. Do you have any other questions about alcohol?
No, I think that's all the questions I have.
All right, then let's talk about drug abuse. Thousands of young people experiment with illicit drugs. Drug abuse is dangerous and deadly, so if you or anyone you know is abusing drugs, please seek help or help the person going through drug abuse seek help. The most popular drugs of abuse with people around your age are marijuana, cocaine, heroin, Oxycontin, Vicodin, crystal meth, ecstasy, cough syrups, medications that use pseudomethadone, inhalants, and alcohol. Do you have any questions so far before I go over the signs and symptoms of drug abuse?
Not that I could think of. Definitely curious about signs and symptoms for drug abuse because I really don't know what to look out for.
Yeah, so some signs and symptoms of drug abuse include reddened or hazy eyes, forgetfulness, agitation, anxiety, nausea and vomiting, hallucinations, paranoia, and slurred speech. So why drugs are so dangerous on the body is because when drugs enter the brain, they interfere with its normal processing and can eventually lead to changes in how your brain works. People with addiction often have one or more associated health issues, which could include lung or heart disease, stroke, cancer, seizures, or mental health conditions. If you are concerned about your own drug use or someone you know, there are many resources that can help, including rehabilitation centers and or programs. Contacting Substance Abuse and Mental Health Services Administration National Helpline at 1-800-662-4357 or even calling 988, which is the National Suicide and Crisis Lifeline. Any of those resources are available 24/7. Now, I know this was a lot of information, but are there any questions or concerns you have for me?
No, I don't think so.
All right, well, if you think of any other questions, feel free to call our office or research on any trusted source on the internet.
Thank you so much for your time and help.
Of course, now you're good to go, and I'll lead you up to the front desk to check out. And that is what I would give to a patient if a doctor asked me to give some information regarding alcohol, smoking, and drug abuse.